have many different services, and we wanted to be able to have an integrated system, one health department, one system, many services.
We visited other counties, we visited other companies and looked at their EHRs, and Patagonia Health was one of the ones that really stood out.
Patagonia was very accommodating. Number one, they are a public health electronic medical record. Some of the other programs we looked at were kind of geared for private practice, which is very different than what we do in public health.
The training was wonderful. They came to do a 2-day training for us, for the clinicians and the nurses and the secretaries. It was a great training.
I thought that they were extremely helpful. They answered all of our probably annoying questions, which we had lots of them.
They were by our sides as we were in clinic. And even before that, we practiced.
The go live day was very smooth. If there was any issues, they jumped in. They were readily available the whole day or two that we first started, which was really helpful.
We felt like they really wanted us to succeed.
We've picked up new front desk personnel, and they were trained in 4 hours. It's an easy system to learn. It's not difficult. And if I could train 2 new people in 4 hours, anybody can do it.
Before we got Patagonia's EMR, we did not have an EMR, so we were a paper chart clinic, which was kind of difficult because you had to make sure you could find records regularly. That was difficult.
For our staff, going from a paper record to using the electronic health record and using Patagonia was just really a breath of fresh air.
In clinic, the template flows, and we had it made just to our liking. So it's very similar to what we were using on paper, but in a template form on the EMR. Medications are easy to see. Everything is very easy to access with the different widgets that are provided. We find that the clinicians love the ePrescribe. Previously, we were writing scripts for the client, or we were calling it into a pharmacy. It is so nice to have it at your fingertips. We also love that we can send labs to LabCorp, and they will upload those labs electronically, which makes things so much more quicker and efficient in that aspect.
I have used about 3 programs, I think, for dispensing medications or dispensing and inventory. Patagonia would be my 4th, and it is the most user-friendly one I've ever found.
So what's really nice on the behavioral health side, which we are able to access, is any of the ongoing assessments. So PHQ-9s, GAD-7s, it's really nice that we have those screening tools. So if a client presents, we're able to assess them at 3 months, 6 months, and kind of be able to see their progress in terms of numbers.
It certainly has helped us as far as our reimbursements in a 6-month period, and we've increased our reimbursements by 13%. Because of the ease that we have with the electronic billing system, we're able to go in, review the claims, send them through immediately with a click of a button, and they go out that quickly. Prior to Patagonia, we did what was called batch billing. It was very time-consuming. With Patagonia, we're able to more efficiently and quickly send the claims through. It's not unusual for us to send a couple hundred claims through in a day. In the last year, we've added our behavioral health department to Patagonia to use for billing and for our encounters and progress notes. Once we started doing that, we estimated within a year that we've probably increased our reimbursements by $102,000.
Most of our reports have been custom designed by the staff at Patagonia with our help. They're invaluable to know certain information so that you can improve your programs.
As a director and as a supervisor, I like reports. I like to be able to see how many people this counselor saw on this day, how much income was generated by this counselor, so that way I can see, hey, are you meeting expectations, meeting productivity standards?
I feel my job has become easier with Patagonia. Everything is right at my fingertips, whether I'm at my desk, whether I'm in the clinic area.
It has freed up a lot more free time for our staff to be doing what they were trained to do and not shuffling a lot of papers and looking a lot of different places for charts and for lab results and so forth.
We're very happy with Patagonia. We're happy with the continued support and the continued improvements and the response that we get when we have an issue, a question, or a concern. They're always there for us. It's not something that somebody just sold to us and said, there you go, see you later. That's not how it is. It's an ongoing relationship.
Patagonia Health has made my life easier in the workplace. Yes, I do love it. I think it's great.